trabaja con inmigración, eso no se puede decir del sheriff, que si se han trasladado, posiblemente ellos puedan tener contacto con ICE. Pero lo que sí sabemos es que la policía de Suffolk no trabaja con ellos, pero como vuelvo y recalco, si usted es después trasladado, puede ahí correr riesgo de que ICE se informen. Sea un buen ciudadano, trate de evitar de manejar sin licencia. Y yo les digo a la gente, a mis clientes, de verdad que si ustedes pueden ir a la tienda caminando, hoy es el momento de hacer las cosas bien, porque si ustedes se están exponiendo a un riesgo y queremos evitar todas estas cosas que les suceden a ustedes porque andaba manejando o andaba tomando y agarré el carro. Traten de evitar eso, eso no es prudente, exponerse ustedes en riesgo, a otros en riesgo y también entonces inmigración, ¿me entiendes? Exponer su estatus en peligro. Cualquier cosa, nosotros en Carecen ofrecemos consultas gratis, viene una vez al mes una abogada, que ahí donde ustedes pueden hablar con alguien si quieren más información sobre sus casos, pero no estén en pánico. Sé que no voy a decir todo, pero por lo menos pueden pasar por la oficina y hacer una consulta con nosotros.
Thank you so much. Thank you so much. That was really valuable. I wanted to ensure something. Quiero reasegurarles algo. You know, nothing is changing as of right now. People who sign up for health plans in 2017 will still have coverage under these plans until Congress takes further action. Until then, everything will continue as usual, and we will inform the members, our members, or if you have applied, we will inform the members of any changes before that actually takes effect. Health First will continue to work closely with the state to address any changes that are happening in the health legislation. We will provide further updates and in other events as soon as more is known about how actions in the federal level will impact healthcare in New York. Hasta este momento, absolutamente nada ha cambiado. Las personas que han aplicado para su Medicaid del 2017 van a continuar teniendo cobertura hasta que el Congreso tome una acción legal diferente. Hasta ese momento, todo va a continuar completamente igual y nosotros vamos a informar a nuestros miembros si algo ha cambiado y si es que hay que tomar alguna acción, les vamos a informar. Obviamente por carta, obviamente en nuestros eventos, los vamos a mantener informados. Health First va a continuar trabajando a nivel del Estado con todas las legislaciones que tengan que ver con salud y vamos a proveer a las familias y a nuestros miembros, updates o información. Hasta el momento no tenemos nada más que esto, pero vamos a proveer información si algo cambia. En este momento todo el mundo debe tener su cobertura y todo va a seguir completamente normal. ¿Ok? ¿Alguien tiene alguna pregunta? ¿Para mí o para las agencias? Sin pena. Anybody has any questions? I have an important guest here that I didn't introduce. I'm so sorry, come up here really quick. She's a Health First friend as well. And this is a very good information for you guys. I'm sorry. No, Katie, she's from Power Up Communities.
Hi, thanks for having me. So my name is Katie. I'm from Power Up Communities, and our program is specifically for homeowners. We offer free home energy assessments so that people can see how their homes are improving and how they're functioning and where they can have energy improvements so that you can save money on your utility bills and be more comfortable in your homes. We're really going to be your advocate throughout the entire process as a service for you all. We connect you directly with specially certified contractors who are going to give you that free assessment. And then they're going to give you an energy report on your home and a list of improvements that you can go through with. You are not obligated to go through with any of these improvements. They're there for you to make an informed decision about your home, to help you save money on your energy bills, to help you have a lower impact on the environment by not consuming as much energy, and to make sure that your homes are warmer in the winter and cooler in the summer. There are a lot of other benefits to our program, but to save time, I'll keep it short. You can come see me. I have flyers that are in Spanish as well. So yeah, that's really it.
Thank you. I'm going to translate really quick. Katie is here for Power Up. Ella nos va a ayudar con todo lo que tenga que ver con el servicio eléctrico, cómo ahorrar energía, cómo tener mejor las casitas bien calientitas o bien frías durante sea el invierno o sea el verano. Before I finish, I wanted to make sure you guys know where we are, you know, where the locations of where we are right now. I know some of you probably have seen us in Fifth Avenue, but I have Jose that will be telling you guys exactly where we located. He is one of our top marketing reps, es un representante de salud que cubre el área de Brentwood, so él va a estar mencionando dónde estamos y qué necesita usted en este momento para que le diga a sus amigos o familiares, what do you need if you wanted to apply for insurance.
Good evening, everyone. So I'm a representative for Health First. I assist people in attaining health insurance. Pretty much we're all over Suffolk County. We work in Eastern Suffolk and Western Suffolk as well. We're at the mall. We have a new site at the mall, Westfield Mall. It's a kiosk in front of JCPenney and Panera Bread. We work directly. We're there 7 days a week. We work directly with the Hudson River Health Center, as well as Express Medical Care, and Adelante, and the Head Starts as well. I personally worked at the branch in Wyandanch. We're all over. We assist in helping people apply through the New York State of Health. What's usually needed is some form of Social Security, some form of ID, and proof of income. That's sufficient information to get your application started. Should I go on for kids? Some form of document like a birth certificate in terms of for kids, for children. We offer Medicaid, essential plans, Child's Health Plus. There's different plans from 0 to 65, to 64, I'm sorry. And I mean,
Very good. Thank you so much. Claro que sí. No, tu español está mejor que el mío.
my Spanish is a
Oh,
little low. So ofrecemos,
all right, no problem. Don't forget encarecen the sign-up classes in Spanish. So es importante que todos sepamos, estamos en el mall todos los días de la semana, hasta los domingos. Trabajamos incansablemente para ayudar a la comunidad. Estamos en la escuela de Brentwood, estamos en Head Start, estamos en Adelante, estamos en todos los Hudson River, estamos en Express Medical Care y mis otros partners están con nosotros siempre en nuestros eventos. So, me gustaría que si tienen alguna pregunta, se sientan completamente tranquilos de preguntar. Es muy importante que ustedes sepan que nosotros no compartimos la información que ustedes o sus familiares nos dan a nosotros cuando hacemos su aplicación de salud. Nosotros firmamos un documento con ustedes que es un HIPAA que dice que su información no va a ser compartida. Y esto es importante porque sus hijos tienen derecho a Child Health Plus, no importa la situación migratoria que tengan sus hijos. So, es importante que sepan que no vayan a dejar a su hijo sin seguro de salud por temor a que vamos a compartir la información. Eso nunca pasa. ¿Okay? ¿Alguien tiene alguna pregunta? Marvin? I think we did it.
How many of you are familiar with Southside Hospital? How many of you are familiar with Northwell Health? Not as many hands. Northwell Health, Southside now is part of Northwell Health. I sit on a committee called the Community Organizations Health Education Council at Northwell Health, Southside Hospital. They work with a number of these organizations here in the room. And one of the things that we are doing is that we are coming up with a model of how Northwell Health will interact with all of the 21 hospitals in their catchment areas. And so there are many services that Northwell Health is making available to our communities. We're working very closely with Central High School and Brentwood High Schools. right now, they are giving free screenings, health screenings to teenagers, high schoolers, right now at Northwell Health at no cost to their parents. They do a number of different services. They are also adults. Tomorrow is what? The 17th?
Yes.
The next day is the 18th. Between now and then, the 18th, any adult can get cardiac screenings at no cost. All they need to do is make a phone call or go online and set yourself up for those appointments through the 18th. There are many services that Northwell will be offering. Olga from Adelante, myself, and Helen Moss sit on that council. And we're going to make sure that if they want to do services, we're going to make sure they have some people to do services with in Brentwood and Central Islip and North Bayshore. They say they want to bring services, we're going to make sure that they bring those services. So keep your eye out for all of those offerings from Northwell Health. Because, as I said from the beginning, the greatest challenge we have is access to quality, affordable health care. And so that's why these organizations are in the room this evening. So we want to thank you. Do you have any questions? Any question that's on your mind that's health related? I'm sure if Health First or someone else might be able to answer that question. No questions? Boy, that's pretty good. So please do not forget, on the 21st, the Black History Program, there will be music, there will be steel drums, there will be dancing, there will be singing, and I think about 14 awards are going to teenagers. And you will also have some of these same people here that evening. But you will see a lot of seats filled. Oh, we're going to have a Black History quiz. And it will be, well, I'm not going to tell you where it'll be. We'll tell you that night. But there will be prizes for those who can answer the questions, the Black History questions that are being asked. And if you have any money, I'll give you the answers now.
Are you bribing?
I'll bribe in a minute. So please try to make it out on the 21st for the Black History Program here in this room. In this same room on the 28th, Legislator Monica Martinez will have her Black History Program. So that's the 21st. Please mark your calendars. The 21st at 6:30 and the 28th at 6:30. Anyone have that information? It's either 6 or 6:30 on the 28th. You have it already. No, it's the Black History Program. So we thank you. We thank the sponsors. We thank them for bringing information. We hope that you do not leave here and there's some information to be shared. And as I said to the folks representing Long Island Head Start, I remember going to Washington in 1970 to protest the cuts in Head Start, and here we are again talking about the same thing. And they say, well, don't you get discouraged? No. I take the baton, and then I'm going to hand it off to some of these young folks in here so that they can carry it further. Especially these young folks over here. And are you members of the Youth Council of the NAACP? I'll tell you what, the Youth Council will get to go to the National Association for the Advancement of Colored People Convention if they qualify. They will go, and the adult branch pays for them to go. They spend about 8 or 9 days at the convention site. I introduced some of the Youth Council members to Barack Obama in Philadelphia, Pennsylvania.
We need the next leader.
So we have a really powerful youth council, and we have an AXO program for Afro academics, cultural, technological, and scientific Olympiads, they compete for awards, scholarships, and then they get to go to the state and the national conventions.